together a lot. And so that's where I was introduced to the program. And it took me quite a while to warm up to the whole idea. And a year later, I found myself back at that program. And I had taken time for many years with my patients to say, you should do this, and you should do that, and you should talk to this nutritionist, and you should go do this exercise program. And I would see them a year later, 5 pounds heavier or worse, and frustrated. And so at that point, I was at the same time going through my own process, starting to lose what was a total of 23 pounds. And so at that time, I was doing it the old-fashioned way. So I became a doctor with the program. So I'll come back to that in a moment. At the same time, I was in about a 3-month period of time of trying to eat less and do all the things that I was discussing with my patients and exercise more, and it was not working well. It was not going well. It was working, but very slowly, very frustrating. And then I was at a meeting similar to this type of meeting because, as I said, I was already doing this program with my patients. And it was actually Whitney who said, you know, you can just do this. You don't have to do this for a lot of pounds. You can do this for some. So I said, you're right. In 5 weeks, I took off 15 pounds. And I had been telling women that they can lose 2 to 3 pounds a week on the program. But when it actually happened for me, of course, that gave it a whole nother level of credibility for me, as well as being able to talk about it with my patients. So, and that was almost 2 years ago, and it's not, with this program, it's just not difficult to keep the weight off because of the structure of the program. With my patients, it's been a joy because it's easy. Dr. Anderson says goof-proof. I say brainless. I call it brainless. But I know that doesn't sound as good as goof-proof, so I'm supposed to use his words. It's really goof-proof. It's a simple program. It's easy for people to stick to. My patients get quick results, which, of course, in our fast-paced, give it to me right now society, people like. And I like it too. I like my patients to have quick results too. And it has been just so much fun seeing my patients shrink, meeting like-minded people, getting to work with other doctors and all sorts of different health professionals in Take Shape for Life, going to meetings, learning more. I like to tell my patients that in 4 years of medical school at UC Irvine, I had 1 week of nutrition training. Usually that gets the right effect from them. They realize that that's not a lot. So I've learned a lot being a doctor for this program. And this is me. This is my little before and after. And I'll just leave this available. You can take a look. There's only a couple of pictures in it. The first one, actually one of them is Greg Rex, one of the other people who coaches us and trains us. And I'll just show you. This patient of mine was one of my first big success stories. She lost 36 pounds in 12 weeks. And I wasn't even very good at being a health coach at that point, and she just took it and ran with it and did a great job. What she was most happy about, well, 2 things. First of all, her husband's an ENT, and she stopped snoring. So that really was impressive to him. And what she cared about the most is her cholesterol dropped by 30 points, just in that period of time. So it's very, very exciting to help people actually get healthy. I finally have an effective tool for myself and for my patients. So I'm excited to be here tonight, and I love that video.